Okay, so we have a 17 months old baby presenting to the emergency department with non-blanching rash on both legs and abdominal pain. Mother noticed the rashes 2 days ago on both feet, but became concerned when the rash seemed to spread to cover the shins and calves and eventually the buttocks. The boy actually had a cold 4 weeks ago. On examination, there is widespread rash consisting of palpable purpura, which are round and distributed on both lower legs and seem to be coalescing around the feet. The rashes, however, are not painful. There is no pain or inflammation of the joints either. Blood pressure is normal and heart rate is 120. On the right, you can see the blood test results and the picture of the rashes. So I'll give you 5 seconds to pause the video and come up with your diagnosis. Okay, so the correct answer is Henoch-Schönlein purpura. So let's work this together. So we have a young patient who is presenting with abdominal pain and rash. So you might be thinking of celiac disease as well, because that can also present in a similar way. So abdominal pain and rashes described as dermatitis herpetiformis. Moving on, the rashes seem to be localized to lower limbs and then spreading to the calves and buttocks, so bear that in mind. The boy also had a cold 4 weeks ago. Going through the other options, we can see idiopathic thrombocytopenic purpura. We can rule that one out because the platelet levels are within normal range. Generally speaking, in ITP, the platelets are severely low in numbers. So let's rule that one out. We can also rule disseminated intravascular coagulopathy. This is not actually a disease, it's actually a manifestation of other things such as septic shock or even blood transfusion. It's kind of consumptive coagulopathy, so we can rule that one out as well. And also the patients are more unwell, so they will have signs of septic shock. Meningitis, again, we can rule that out because we don't see any signs of photophobia, Brudzinski sign or Koenig sign, neck stiffness and those things. Pemphigus vulgaris, we can also rule that one out because the rashes seem to or tend to be present over the trunk rather than the lower limbs. So let's learn a bit more about Henoch-Schönlein purpura. So the clinical features include purpura, which are palpable and are classically on both lower limbs and buttocks in the young. Make sure that the patient is young. There's also abdominal pain, mainly due to GI vasculitis. And there's also joint pain or inflammation. These are actually early signs. So early signs. But sometimes they can be absent. There's also renal involvement, primarily due to immune complexes such as IgA complexes being deposited in the kidneys, which will commonly present as proteinuria and hematuria. Population-wise, mainly happens again in the children of 4 to 7-year-olds. So in terms of pathology, HSP is the commonest systemic vasculitis in children. The cause is unknown, but it is thought to be due to IgA deposition in the affected organs. Interestingly, there is a risk of intussusception, so you want to do regular abdominal ultrasound. There's also, like we said, renal complications after 12 months. So do a regular follow-up to make sure that the kidneys are working well. Other risk factors are atopic and allergies. In terms of management, it is mostly supportive with analgesics for pain. Steroids are a bit controversial because it's mainly given to moderate to severe cases. And prognosis, however, is very good with complete resolution by 6 to 8 weeks. So I hope that was helpful.